Mrs. Johnson. How can I assist you today?
Good morning, doctor. I've been experiencing frequent episodes of bloody diarrhea, along with abdominal cramps and fever. It's been quite concerning and uncomfortable.
Thank you for sharing your symptoms, Mrs. Johnson. Based on your history, I suspect that you may be experiencing dysentery. To confirm this diagnosis, I will need to ask you a few more questions and perform some tests. Let me explain how I arrived at this diagnosis. Mrs. Johnson presented with bloody diarrhea, abdominal cramps, and fever, which are suggestive of dysentery. Dysentery is a type of gastrointestinal infection characterized by inflammation of the intestines, often caused by bacteria or parasites. Mrs. Johnson, I would like to know more about your symptoms. How long have you been experiencing these symptoms? Have you traveled recently or consumed any contaminated food or water?
The symptoms started about 3 days ago, and I haven't traveled recently. However, I did eat out at a restaurant a few days before the symptoms began.
Thank you for the information, Mrs. Johnson. Based on your symptoms and recent exposure, it is likely that you have acquired an infection causing dysentery. To confirm the diagnosis, I will order a stool culture to identify the specific pathogen responsible for your symptoms. It's important to differentiate dysentery from regular diarrhea. Dysentery is characterized by the presence of blood in the stool, along with abdominal cramps and fever. This distinguishes it from non-bloody diarrhea, which is often caused by viral or non-infectious causes. While we await the results, it is crucial to manage your symptoms and prevent dehydration. I recommend increasing fluid intake to replace the fluids lost through diarrhea. Oral rehydration solutions can be helpful in maintaining electrolyte balance. It's important to educate the patient about the significance of fluid replacement in dysentery. This helps prevent dehydration and electrolyte imbalances, which can occur due to the loss of fluids and electrolytes in the stool. Mrs. Johnson, I will also prescribe an antibiotic to target the specific pathogen causing your dysentery. Once we receive the stool culture results, we can tailor the treatment accordingly. In the meantime, it is important to practice good hygiene, such as frequent hand washing, to prevent the spread of infection. Dysentery is often treated with antibiotics, such as ciprofloxacin or azithromycin, depending on the identified pathogen and local resistance patterns. Treatment duration typically ranges from 3 to 7 days, depending on the severity of the infection. Mrs. Johnson, I understand that this can be distressing, but with appropriate treatment and supportive care, you should start feeling better soon. Please follow up with me once we have the stool culture results, and we can adjust the treatment plan accordingly.